Hello, Dr. Rita. Thank you for taking the time to coming on our show.
Thank you for having me. It's just, it's an honor and a privilege to be here. So thank you for the invitation.
Yeah, that's great. Why don't you start by telling our listeners a little bit about yourself and your role with the Spine Health Foundation?
I'm Dr. Rita Roy. I'm the CEO of the National Spine Health Foundation. We are the premier patient-centered advocacy organization, really in musculoskeletal health and in spine. I'm a general surgeon by training. I spent a career doing medical education and communications, and I came to spine through my own personal story of injuring my back and requiring a spinal fusion. And when I came to
Interesting.
find information about the procedure, what it was like, what the recovery was going to be like, there really was just a lack of information out there. And I wanted to talk to people. I wanted to hear patient stories. And I was really lucky that my surgeon had started a really good website for his practice. And he had also been involved in the foundation that was trying to get the message out about spine treatment and ways for people to connect and learn from others and learn those success stories. And so when I went through my treatment, I was just absolutely blown away by how well I did. And I really wanted to get involved. And so I bring to the organization my lived experience as a patient, my physician experience as a researcher and a
Sure.
healthcare communications expertise, and bring all of that to the organization to get the word out about the good news in modern spinal health care.
Yeah, that's amazing. And it's interesting to know that you kind of found your way to the foundation through your own journey of having spinal issues and then needing spinal fusion so early on and just kind of recovering from that. That's amazing to know. So, if you can tell our listeners a little bit more about the work of National Spinal Health Foundation, because like most of us including ourselves, we didn't know about it for a long time. What does it stand for, about its mission? How does it help people with spinal issues?
Yeah. So, like many people out there, when I was faced with a spine condition, I was afraid, I was confused. You feel a little bit isolated, like you're the only person that is going through this. People don't understand, they don't talk about it. And I really just didn't know where to go for help. And I actually got some bad information along the way. And so for
Mhm.
10 years, I struggled with pretty chronic back pain from a spondylolisthesis that I had. And a doctor told me that I was going to need a fusion. It's a really big operation, but I should try to put up with the pain as long as I could because, it's a life-changing surgery and, that should be the last resort. And
Right.
so, when a doctor tells a woman who's, given birth 3 times, "Can you tolerate some pain?" You
Yeah.
just like,
I hear
I can
you.
tolerate
Yeah.
some pain. Yeah.
Yeah.
So 10 years went by that I was putting up with back pain and and my spondy was just getting worse and worse. I was doing yoga and Pilates regularly, managing, building core strength and managing the spondy in that way. But really just didn't have good information out there. And I was petrified from having back surgery. So when I did have my fusion, what got me to that point was not the pain, was that
Hmm.
my foot started going numb and I started having numbness and I thought I was having a stroke. I couldn't feel my foot. And
Right.
that nerve paralysis is what got me in to pay attention to what was happening in my spine. And
Hmm.
I had I had the nerve conduction test, and I was, on my way to having foot drop, which is sort of permanent nerve damage there. And
Hmm.
so here I was so afraid of getting treatment, of getting the definitive treatment for my spine, that I was putting myself at risk for long-term paralysis.
Right.
And so that's what really drives my passion in my job, is to say it doesn't have to be that way. Get There are great treatments. They get you back to your life, and do it. Don't delay treatment. Do it while you have options. Because if you wait too long, you have fewer options for getting better. And so that is all sort of what we do here in the foundation, is that we are a nonprofit. Um, the information that we put out is it is vetted by experts who help us
Mhm.
create our content. It is governed by our 65-person medical and scientific board, which is sort of the who's who of spine experts in the world.
Sure.
We have
Mhm.
formed a coalition with the professional spine societies. So we have partnered with them to be the go-to patient education source. And we don't do advertising. So there's, it's unbiased information. It's vetted by the top, minds in spinal healthcare. And we produce our content and we make it free and available to the public. So it's a little bit
Mhm.
like the PBS model of public broadcasting service model, where we do we do fundraising with companies and individuals and foundations to help us create our educational programming. So you might hear something that says, this program made possible by an educational grant from X company. But
Sure.
there's no advertising. So we don't do banner ads, we don't promote any products. And in that way we really maintain the integrity and independence of our content, so that we're
Mhm.
presenting the full story on these
Right.
spinal treatments.
Yeah.
So that's,
They,
that's on the educational side. And I would say that, there's a lot of places that you can go to kind of consume brochureware about, you know, surgeries or devices. And so we try to take that a step further and not just be like written encyclopedias and, dictionaries of spine terms and procedures, but we've created community around what we're
Mhm.
doing. We call it the Spinal Champion Community, where
Mhm.
people share their success stories and they serve as advocates, so that if
Mhm.
somebody comes on the website, they can find someone that is maybe their age or their gender and has a similar kind of condition, and they can say, oh, I'm a 75-year-old lady that needs a neck disc replacement. Let me go find somebody and I can talk to that person about it. So we train
Right.
the advocates to know how to talk to people, and so we have this community here. So it's rich information along with a community. And I think that's what's unique and exciting and special about what we do.
Yeah, no, I love it. Like you said, the real stories from real people who have gone through the journey themselves. I think that's as authentic as it gets. And the fact that it's nonprofit, it doesn't include any paid promotion like we see on YouTube and other channels. So that's also like more reassuring for your listeners
Yeah.
or people who can use these resources. So it's great to know that. Just from all the data that you have, or if the foundation has any specific guidelines, because that's most of our listeners is people 50 plus active adults. How can they like take better care of their spinal health? Because as people after 50s, degenerations coming in, how can they take better preventative care of their spines? Because majority of us starts to have backaches, spinal issues. How can they take better care of their spinal joints?
Yeah. So a couple of statistics along those lines. 100 million Americans suffer from a neck or back condition every year. If our
Mhm.
population's about 300 million, that's approximately 1 in 3 people. So, a
Right.
message to the listeners is that you're not alone. So that's one sort of fact out there. And some other interesting statistics about back conditions. When I say back, neck and back. So the
Yeah,
spine is your neck
the
and your
spine.
back. And sometimes
Yeah.
people don't even realize that your neck is part of your spine, right? You've got your cervical spine, which is your neck. You've got your thoracic spine, which is your middle back where the ribs come off of. And then you've got your lumbar spine, which is your low back. And so that whole continuation of those 33 vertebrae that make up your spine. The spine conditions are the number one reason why people miss work. Number one reason why people call in that they can't come to work is because they've got a back issue. And the number one cause of disability in the United States and in the world is spine conditions. Most of those spine conditions are degenerative conditions of the spine. That is what
Mhm.
afflicts just about everybody. And so, some of our doctors will say things like life is a degenerative condition, right? So as you
Sure.
age over time, the wear and tear that you put on your joints, we think of our knees, we think of our hips, but the back is a series of joints as well. And so the back is just as susceptible to arthritis and wear and tear over time, just like any other part of your body is. So it's
Mhm.
important to think about your spine as you age because it's literally your backbone. It's literally the thing
Right.
that takes you through life. So a healthy spine is what carries you through life. All of your important musculature comes, is hinged onto your spine. So big, important
Right.
muscles that then move your arms and move your legs and help you ambulate. So when we think about spinal wellness, I kind of think about it in four buckets, right?
Mhm.
You have your body weight. So maintaining a good, healthy body weight really helps your spine because you think about, carrying extra weight around. It's sort of like if you went and carried 20-pound dumbbells in each hand, that would be 40 pounds. You can see how tired you get quickly carrying that weight around. If you had to carry 40 pounds in a backpack all day long, you would feel that. It would make you tired in your
Right.
back. So just
Yeah.
imagine that and there are metrics that convert, so every pound of body weight is like 4 pounds of gravity that's pulling on your joints. So
Joints. Yeah.
everything you can do to maintain a healthy body weight is what's going to help your spine over time. So that's one thing. And the other thing with body weight is that it is linked to a higher rate of osteoarthritis developing in your body. So that the wear and tear, the strain that you put on those joints leads to a higher incidence and increased incidence of osteoarthritis. That's true for your
Mhm.
spine joints, but also hips, knees, and ankles. So
Right.
body weight, that's one bucket. The next bucket to think about is bone health. We in our nation and in our world actually are facing an
Mhm.
epidemic of osteoporosis. Osteoporosis is a
Interesting.
silent disease. And
Mhm.
it's a disease that we often think about with little old ladies. Well, actually, osteoporosis is something that affects everybody. And most
Mhm.
people don't think about bones as living, breathing tissue that changes, and it does. And
Right.
so it's really important to maintain bone health, not just for your arms and legs, but also for your spine. And the reason
Mhm.
for that is that osteoporotic fractures occur more commonly in the spine than anywhere else in the body. People think
Mhm.
about, people fall and break their hip, when they're old or they have brittle bones. Actually, those
Sure.
fractures occur more often in the spine than anywhere else in the body. And the spine is also a very common place for secondary fractures. So if you break another bone, you're very likely to break a vertebrae,
Second one.
break a bone
Yeah.
in your spine. Secondary fractures. So primary fractures and secondary fractures in osteoporosis affect the spine. And why is that a big deal? There's an increased link to
Mhm.
mortality when you have osteoporosis and spine fractures. So there's a study that came out in January of this year of
Mhm.
2024 that looked at
Mhm.
CAT scans, so CT scans of people who go into the hospital for other conditions, abdominal pain or what have you. And when the radiologist is looking at those CAT scans, if they
Mhm.
happen to see a previously undiagnosed spine fracture, those
Mhm.
patients have a 50% higher mortality rate than those who don't have spine fractures. So we know that getting fractures in your spine is linked to early death, and that's a big deal.
Interesting. Mhm.
So it's a very important thing. The other thing is preventing those fractures in your spine is so important because there's not great treatment for osteoporotic fractures. There's
Mhm.
actually not a lot that can be done because of the nature of the way the anatomy is in those vertebrae. There are things
Right.
like putting cement in those fractures or break, but those things are only short-term remedies. It's really you want to prevent getting fractures in your spine. So
Mhm.
we have an epidemic of osteoporosis. It affects men and women, more often in women. But it is also affecting people at younger and younger ages. And there are lots of reasons for
Mhm.
that. And we have a lot of resources on our website that you can look up osteoporosis and find out why. Things like Young women who take birth control medicine have a higher rate of osteoporosis because they're changing the hormone feedback loops in their bodies. So it's similar to a postmenopausal condition on bones. Young kids who are gaming indoors, they're not going out in the sun, they're not getting the vitamin D that they need, they're not absorbing
Mm-hmm.
the calcium, so they're not building as much bone as they need. We have a
Right.
society that lathers up in sunscreen. There's really good reasons for that, but we also just need 10 minutes of sun
Yeah.
exposure every day so we get our vitamin D dose. So, lots of
Right.
reasons for osteoporosis to be a problem and a big
Mm-hmm.
problem for spine people. So, maintaining your calcium, vitamin D, and avoiding osteoporosis is a very important part of maintaining your spinal wellness as you age. So, we talked about
Mm-hmm.
body weight, I've talked about bone health. Another
Mm-hmm.
area is in posture and balance.
Mm-hmm.
As you age, you lose balance. That's just part of
Right.
what happens as we age. But balance is something that can be built up like a bank. If you practice your balance, you can maintain balance. So, why
Mm-hmm.
does balance matter? Because it's all about falls, right? We want to prevent falling down because falls can lead to fractures, and fractures, as I said, can lead to dying younger than you ought to or that you should. So,
Sure.
balance is very important, and maintaining good posture. You want to balance your head over your hips. So, kyphosis is a condition where you become hunched, and that can happen with degenerative changes in your spine. So, being able to keep those muscles strong that support your spine and that will give you good posture and good balance are going to help you prevent kyphosis that can come with the natural aging process. So, those are just kind of four things to think about
Yeah.
that are very important as you age to maintaining spinal wellness.
Yeah, no, I love it. You hit like all the key areas, something we hear and see in people 50 plus all the time. And a good breakdown that osteoporosis is something that is seen both in men as well as women, because we definitely see women concerned about it or talk about it. Men usually don't think about it as much. So it's good to know that it affects both of them, as well as the balance piece. Like you said, it can be built, something we can help people to build their balance to minimize and prevent the risk of falls and keep them mobile and active for as long as possible. That's really good information. Anything else you would like to add for our listeners, and also how they can reach out to you, or to the National Spine Health Foundation in general?
Yeah, I would say that, there are two things to think about when you think about your spine. There's the wellness and prevention aspects, right? So we want
Mhm.
to take care of our spine so that we prevent bad things from happening. But when something does happen, there
Right.
is really good news in modern spinal health care. And I want people to understand that a well-trained spine surgeon is one
Mhm.
of the best places you can go to get information about how to take care of your spine if you have a spine condition. And a lot of times people will say, well, I don't want to go to a surgeon. He's just going to want to cut on me.
Right.
80% of the time, when patients come in to see a spine surgeon, they do not need spine surgery. And the spine surgeon is the specialist in our society who is trained in the entire spectrum of treatments for spine conditions. So,
Mhm.
everything from acupuncture, massage therapy, yoga and Pilates, physical therapy, manual, therapy, dry needling for musculature, injections if that's going to be a thing, all the way to the end of, I say the end, surgery. I mean, sometimes
Right.
surgery is what's needed when there's
Right.
a, just an anatomic problem that's just got to be fixed. But a
Sure.
lot of times it's not. So the spine surgeon is the person who's qualified to evaluate your spine and help you understand the kinds of things that can help you get better. And so that's one thing that we really talk a lot about is, if you think you've got a problem, a back problem, um, don't hesitate to see a specialist because they
Mhm.
can really help you navigate your journey. The other thing, Trina, and this is something that maybe you can help and maybe you do a lot with your education, is that in many states in our country, you do not need a prescription to see a physical therapist. And
Right.
so, we really encourage people, if you think you've thrown out your back, you went to take out the trash and you did something funny and you pulled your back and now you can't move, go see a physical therapist. That is a
Mhm.
really great first line of defense, sort of a first line of like, what do you think is going on here? And, physical therapists are uniquely trained to understand the biomechanics of your body. And so they can help you figure out if you're going to get better after a couple of weeks with maybe some non-steroidal anti-inflammatories and some gentle exercises, or if there is a more serious condition that's going to need further evaluation. So those are kind of some of the things that that we like to talk about, is that there's the wellness and prevention side, and then there's really good news on the treatment side.
Right.
And go be an advocate for yourself and getting the information that you need to get back to your life. None of us have time to lose. We're not
Right.
throwing years away, right? We want to live every year
The best
to
life.
our
Yeah.
fullest potential, to our best life. One thing that your listeners may want to know, if you're in the Reston area, in October is Spine Health Awareness Month. Congress has declared Spine Health Awareness Month, and we do a 5K. It's the We've Got Your Back 5K. So
Yeah.
there's a lot of spinal champions, and our whole staff is there, and we celebrate spinal health. And so that happens in Reston every year in October, and we've got information about that on our website. And in the spring every year, we do an online activation program. We call it the
Hmm.
Spring Spine Health Challenge. This year, it was a yoga inspired challenge. You can sign up for it, and every day you get like a little exercise in your inbox with some description around why we're recommending doing this exercise, and ways that you can empower yourself to just stay healthy as you go through life. Exercises
Right.
you can do when you're sitting in your desk at home, or just through your activities of daily life. So prevention, wellness, and treatment, we have the information at spinehealth.org.
Love it. Love it. I love how you summarized like two big spectrums, like prevention. How can we prevent it from happening in the first place? And if it does, then too, we are so lucky to be in this modern era where we have so many treatment options, which have a really good outcome rate, with really good success rate. So one way or the other, like you said, literally, we've got your back, and it's nice to have it right here in Reston.
Yeah.
Uh,
We
all
should we
right,
should
yeah.
say we've got your neck and back, but
We got your neck and back. Yeah, we've got your spine.
got your spine.
uh, yeah, yeah. It was nice chatting with you, Dr. Roy. And yeah, thanks for taking the time for coming on our show.